So I'm Fran and I'm Chief Exec of Greater Manchester Mayor's Charity, and I've just said a little bit about that. And I'm now going to come to each of our panelists in turn who are just going to say a little bit about who they are. So first, can I introduce Jayne Hesketh?
Afternoon, everybody. Thank you for joining. My name's Jayne Hesketh. I'm a hubs manager at the Brick, so I basically look after two of our emergency accommodations, one of which is specifically for young people because we recognise the additional challenges that they have alongside everything else. It can be really difficult to engage, and it can be a frightening environment as well for anyone, but for young people it can be a particularly scary experience. I also manage our social work students, so we have social work placements here at the Brick to give them an experience, which is always an eye-opener. Everybody always loves it when they come because it's something completely different, and it really is the grassroots of social work. Really, you're probably more working with people on a day-to-day basis than you would see them normally as a social worker. So we work with universities right across the northwest, which is really nice. It's an absolute privilege to be able to be part of that, to train up our new social workers. So a little bit about the Brick. So the Brick is based in Wigan and Leigh, and it's actually over a century old. It was actually founded in 1908, and that was the Queen's Hall Methodist charity. In 2013, it's now the Queen's Hall Action on Poverty. So we are a homeless and anti-poverty charity, but still a relatively small charity, taking on this massive challenge that we all are, but we do it with love and compassion. Everybody does. We currently provide 108 emergency beds every night. We have an outreach service for rough sleepers that go out in the morning. We have supported accommodations. We have a food community. We have a multi-bank. And last year, there were, with the shocking statistics that we've just seen, we supported just over 16,500 people. That's people, families, and children in need at the minute. So we support the whole community in Wigan and Leigh, for anyone who's facing homelessness or poverty.
Thanks, Jayne. And I did not know you were 100, or the organisation, not you, were 100 years old. That's very impressive. Yeah. Amazing. Next, then, I'm going to come to Fay Counts from the Booth Centre.
Yep. Hi, I'm Fay Counts. I'm the Senior Fundraising Manager at the Booth Centre. We're not as old as the Brick. We're in our 30th year, so we're babies compared to Jayne's place. But we are basically a community based in Manchester. We're on Cheetham Hill, but we see people from all over Greater Manchester, and we're starting to do some outreach work as well to try and get into some of those communities of people that can't get to a centre for support. We operate essentially as a hub. So you come into our space. Our cafe is at the heart of our community, and it's run by people who use our services through our volunteering program. It's a real social space. That is one of the biggest things that people have trouble with if they are at risk of or experiencing homelessness. They can be very lonely. So from that space, they can just kind of relax, get nutritious meals, and then access a full range of agency and partner support from there. So our staff and also a number of social work students who are also on placement with us from Manchester Uni and Salford Uni can get to know people. And basically, so many people who find themselves at risk of homelessness don't know where to start. Where do you start? So as a hub, come here and we can hook you up with whatever it is that you need. Because the main thing is that people get help immediately at the point of access and not be referred on. So we don't require any referrals, just come through the door, and people can take part in arts activities, sports activities, job club, skills development, the volunteering program, like I mentioned, or just have a cup of tea and come for as long as they need us. We are adult only, so it's 18 plus, predominantly men. I think about 85% of the people who come through our doors are men. And generally kind of probably more in the 35 to 60 age bracket. And increasingly, people that are coming through our doors aren't homeless. Not everybody is rough sleeping or homeless or in temporary accommodation. A lot of them are trying to deal with rising costs and trying to stay in their home. So that's a lot of the people that we support as well.
Thanks, Fay. I certainly think that housing instability and insecurity is going to be a common theme in some of the challenges. And again, you can already see some of the breadth of experiences and people that are supported, from the young people, Jayne, that you were talking of, Fay, right through to the 18 plus men that you talk to. Katie, can you introduce yourself, say a little bit about Boaz, who you work with?
Sure, of course. Hi, everyone. I'm Katie. I'm Head of Support Services at the Boaz Trust. Again, I was going to say we're over 20 years old, but that feels minor compared to over a century. Well done, Jayne. But yeah, so we provide accommodation and support to people who are homeless after an asylum decision. So either a positive decision when they've got their refugee status, or negative and they've been refused asylum. And that accommodation has looked very different over the last 20 years, with housing, hosting, night shelters, but at the moment that's provided through 15 shared houses, mostly single adults. And as well as our accommodation and kind of that holistic support that people have access to through a named support worker when they're in our housing, we also deliver outreach support to other people facing homelessness with insecure, uncertain or changing immigration status. And we try to use what we learn through our frontline work and support work to also engage in advocacy work to try and challenge or change systems that cause destitution locally, regionally, nationally, as well as seeing positive reform to the asylum and immigration systems. So our office is based in Hume in Manchester, and our accommodation is in Manchester and Salford, but through our outreach or floating support, we work across the other boroughs in GM as well. Yeah.
Thanks, Katie. And again, we've got a real mix of geography as well, so you can see the kind of breadth of what's going on, and also the parallels between what Boaz Trust and Booth Centre do, and then how that interacts with the kind of provision we've got over in Wigan with the BRIC. So I'm going to ask you all to share some reflections on some questions. And Jayne, I'm going to come back to you here. So could you please tell us a little bit about the sorts of issues you're facing in your service at the BRIC?
Yeah, of course. As well as homelessness, there's many other issues. There's the housing crisis that we've already spoken a little bit about, the cost of living crisis, which is affecting an increasing number of people across the borough. And we're often seeing more and more complex issues. So there's lots of things. It's not just one thing that's going on. It's often multifaceted. So there's lots of things going on for people at the same time. So it's really important that we give that empathetic response and try and get as many other services involved as we can, because this isn't something that any of us can do on our own. We need the support of the services. Some of the issues that we're facing include mental and physical health, substance misuse. A lot of people are coming through with a history of trauma, other forms of abuse and domestic violence, and also people that have been involved in the criminal justice system as well. We're seeing more and more prison releases just come through and leaving prison to becoming street homeless, which is really problematic in itself, and is probably a whole other lunch and learn. But just to give you the scale, really, I just wanted to say about the young person's hub that I manage. So just to give you an idea of the demand for that. So we have a 4-bedroomed house, which I'm in at the moment, and we'll really try and make that like a family environment, because we know the complexities of these younger people, and they just need a little bit more support, so we can teach them social skills, life skills. We do sessions on being good neighbours. So it's all of those other issues. They may not be socialised, they may not feel confident enough to speak to the doctor or go to appointments on their own. But for a 4-bedroomed house, and it is emergency accommodation, we had 21 referrals last quarter, which is absolutely huge, and kind of just demonstrates the gravity of the situation, that more and more youth homelessness is coming through. So prevention is a real thing that we're looking at and trying to focus on. We have the Youth Pathfinder project as well that runs. So we have a team of people who support people who are at risk of homelessness to prevent them from coming through and accessing emergency services and emergency beds. Issues mainly, as I said, housing, the shortage of social housing, the lack of affordable housing, just getting the right housing as well. We're not about just putting people in houses, because there's so many other issues that we need to address. First of all, do they want to be there? Are they going to be okay there? What we don't want is for them to come back round. So we don't want the tenancies to fail. So we do a lot of work around how you're going to keep this tenancy. So we have honest conversations about the bills that they're going to have to pay and that they might be sharing. So we try and prepare people as much as we can. As I said, with the hubs, that's one house. The demand for emergency beds is absolutely huge at the minute. We're seeing more and more people coming through, and we don't have the move on options. So that's really one of our main issues. You know, we've got queues for emergency beds, but we need to get people moved into supported accommodation or private rent or into social housing, so we can free up these beds for more people who are coming through. We're also seeing a really high demand at the food community. Again, everything interlinks. It's not just one issue in isolation. There might be a number of things that people are facing, but we're finding more and more people are accessing the food community. And we do it as a food community to give people that dignity and choice back, so they can come in and they can choose what they want, rather than the archaic view of, here's your food parcel, you will eat pasta and tuna for 3 days. We might put you some hot dogs in. We always try and do fresh and healthy fruit and things like that, but we want people to be able to choose, you know what I mean? So, but we're seeing more, and I think this is a really illustrative point really about the situation that we're in. We're seeing families that are working full time. You know, I seen somebody in there the other day in a nurse's uniform. It's not just the people that you think of that are needing support at the minute, it's the wider community that are needing that additional support because of all sorts of other things going on and the pressures of life as well, of just getting difficult. It's just getting difficult for everybody. Other issues are getting people back into education, training and employment. That's a big one as well that we try and work on. There's also that recognition that people may not be ready to get back into education, training and employment, which is absolutely fine. We're not prescriptive. I'm not just about, you'll feel better as soon as you get a job, because it's not the case. They may need to work on the mental health. They may have physical things that they need to do. They might just need to get themselves back together a little bit and have a bit of a breathing space, because being homeless on its own in isolation is a really traumatic experience. So it's not, you know, the case that if somebody can just go back to work, they can do. That said, we have had people come through who are needing access to emergency beds who've had relationship breakdowns. We're seeing that more and more. Family aren't able to accommodate because also they're struggling with the cost of living and things like that. So they're not always, or with poor mental health, they're not always able to take an extra person into the home. That tends to be a quicker process for people who are coming in without the substance misuse issues or without the mental health issues, the physical health and things like that. So we can try our best to get them in touch with private landlords. There's schemes through the council to try and get them in and things like that. Financial insecurity and the cost of living is, as we just said, it kind of builds it all up. Another issue that I really thought was really poignant to mention really is the emotional toll on staff that this is taking, because we're seeing more and more people come through. We're hearing more and more traumatic stories, and we need to recognise as well. So as part of our trauma-informed plan, we look after staff as well and their well-being, because also there could be staff that are potentially facing some of these issues as well. You know, we are just human. We are people at the end of the day, and some people may be struggling. We don't always know. It's that thing of, you never know what the next person's going through, so always be kind, and I always try and feed that out. And just very, very quickly, the issues, again, systemic barriers. So without an address, you can't get a doctor's. If you can't get a bank account, you can't claim your benefits. If you can't get to the GP, you can't get any ID. There's a full circle of things that need addressing before people can actually move forward. So that is, we find that that's quite an issue that we try and support people with.
Yeah, and I think that's a really kind of clear illustration of how interrelated and multifaceted this experience is, but also really importantly how central people are at this. It's not just a one size fits all, either for people's support needs or their experiences, or for the staff. I think that's a really important thing to reflect back to people listening and watching. It's, you have to look after people in all senses, so the scale of the challenge doesn't just relate to the people that you were kind of set up to support. Fay, how does this compare to what you see at the Booth Centre?
Well, it's probably not going to be much of a surprise that there is a lot of similarity, and Jayne has really covered so much of it, because there is so much of it. It is that intersectionality of issues and disadvantage that people are facing, and this is one of the things, you know, in a lot of policy and a lot of practice at the moment, people kind of get pigeonholed towards one solution because they've got possibly this one problem. But how can you prioritize necessarily one problem when somebody is dealing with 10? Which one trumps the other ones? And so absolutely having that kind of holistic approach, because we are all just people. The people who come through our doors for support are just people trying to deal with all of those issues all at one time. And it can be really defeating to try and know where to start. So that's why these services are so essential. And everybody, we kind of have our specialties and we're dealing with different areas, but it's all the same problems. It's the same problems, and they aren't different in different areas of the city. You know, that thing about we are all just people, and I think highlighting about the staff is a really important one as well, because that's one of the things is, if, for example, nearly 80% of our total cost is our staff. And that is because that is what the service is. It isn't necessarily a project. It is basically being there for people who've come through the doors. So there's really little scope to reduce any costs or do cost savings, because that's the minimal of what we need. The inclusion is becoming a really big thing. It's something that we've really started focusing on in the last few years, because especially amongst adult men, they are so easily excluded from different services because possibly dismissed or problematic because of anger issues, substance misuse, having been prison leavers and ex-offenders. And it's really important that they're not excluded and just dismissed, because it's a more difficult situation. It's more difficult and time consuming to provide that support for them and to include them. And so that's something we have really been focusing attention on, is that inclusion. And it is an established program now, and it's gone from strength to strength over the last couple of years. We run one-to-ones and group sessions, so people can come together and talk about what issues have come up in the last week. It might be something that happened at the center. It might be something that they dealt with outside of our walls. It might be something in the news, because obviously people are also dealing with flip-flopping policies and insecurity and lack of direction and knowing how to progress. So we try and give them a forum for that. And that inclusion work has been phenomenal. We've actually started to work with Greater Manchester Police, running workshops with them, because if you think back to all the people that were camped outside of Town Hall, and basically they were demonized, and the police had a job to do, security had a job to do, and that was to move them on, but forgetting that they're people. And so really that it needed to be a conversation between the people on both sides. And so we've started delivering some workshops, which have been really well received, and that's an ongoing thing, and going to expand that to the probation service as well, so that there's more of that understanding that, yes, they're just people, and they're not there because they want to be there. People aren't in this situation because they want to be there. So I think that inclusivity and that option to just talk to people, to talk to each other between the services, and, you know, at whatever level you are, let's kind of democratize it. And I know that sounds kind of high and mighty, but that's that's kind of the aim. And just a good example of that, we have a gent named Patrick who's Polish, and he has been working as a volunteer. He's been with us for about 9 months now. And he came through as an ex-offender, long history of substance misuse and anger issues, volunteered in our kitchen and cafe, cooking and serving people their lunches. And he has made such strides that he's now started the very first Narcotics Anonymous group in our center for Polish speakers. And that's just now starting. And it's because he's been empowered through this, and his confidence has grown, and he is now, it's an asset to the community.
That's great. That's such a good example to finish that little bit on. And I think being able to kind of share that with others and say, look what happens when you empower people, when you build people up and you give them the space to reflect and talk. And that comes back to all of that collaboration you were touching on, and some of the bits when we're the idea that everyone's human. I'm going to come back to you that, Fay, in a moment. But before I do, Katie, and again, I know that all these experiences will sound really familiar, but I'm guessing it does resonate with the experiences of Boaz, but to what extent does it resonate?
Yeah, definitely resonates. And after Fay ending on that brilliant good news story, I'm going to come back down with some more challenges, I'm afraid. But yeah, definitely, seeing more people access our service, and yeah, what Jayne was saying about the number of referrals for the capacity of our accommodation. So we've seen almost 350% increase in referrals for our accommodation for people with refugee status in the last 2 years. So comparing January to June in 23 to January and June now, which does reflect the increase in national rough sleeping data, including across GM for people who are rough sleeping after leaving asylum accommodation. And without kind of getting technical into the policy, the reason we've using 2023 as a marker of that is in the summer of that there were some changes around Home Office decision making, and lots of people got positive decisions on their asylum cases, but that meant an increase in homelessness. We have just launched a report kind of explaining the context a bit about that and some of our work relating to it. But yeah, from within that time scale, we've seen massive increase. And as others have said, there's so many crossovers with policies and other things going on across the country, and we've seen continued cuts to legal aid over the years, which mean people don't get legal representation for navigating immigration systems. Things go wrong and people sadly can be facing homelessness. But yeah, as the others have said, level of demand, and also trying to be a place and this that can offer that holistic support, because accommodation, housing isn't an issue in silo, and rather than having to go to multiple different places for one different support need. And that is no criticism of other services, because everyone is struggling with capacity, but just trying where we can to ask those questions to see what else is interlinked with the work that we're doing. And we're a much smaller organisation, but I think is very telling that last year we worked with more people than ever before. It was a real increase in people in numbers. So we worked with over 620 people last year from 50 countries, which I think demonstrates the breadth of the work that we do, the people who need services and are trying to find access services, but also reflects the diversity of Greater Manchester, which is also a real privilege to get to work with people from 50 different countries. But yeah, that is definitely, the number and volume is definitely increasing, sadly.
Sad to hear, but definitely agree, like to hear that kind of diversity reflected in the population, I think is a positive that we can all see. Fay, that kind of again takes me back to what I wanted to pick on, something you'd said. Both you and Katie work directly with people from a very broad array of backgrounds and nationalities and cultures. Are there misconceptions, do you think, about the people that you're working with that make it harder? And is that true for you as an organisation, or for the people that you're working with?
Yeah, absolutely. And I think I touched on that a little bit already, but yeah, absolutely. It's the fact, I think people have misconceptions about people work with, that they are all rough sleeping. They're not all rough sleeping, as we all have described and experienced. And so they might be in a home, they might have a job, but they're still struggling with other aspects of their lives and challenges that are possibly putting that at risk. Definitely, we're seeing a much higher proportion of the people who come to us are from people who have had no recourse to public funds, and they're navigating these political changes. There's this rise in divisiveness that just further marginalizes people and making them feel unsafe. And when there's a lot of political issues around people's migration status, etc., and where they are and why are they here and all of that sort of thing, people are kind of reluctant to put their head up above the parapet, really. And so what we're kind of anecdotally learning, although this is really difficult to measure, is that people are feeling unsafe and therefore they're not seeking help. And they just don't want to raise attention. They don't want to put themselves at risk. So that's going to increase the risk of hidden homeless and mental health issues that go along with that, and just further compounding the complexity of the problems for individuals. The longer that they are dealing with these challenges, the harder it is to get out of it, and they're going to just feel more isolated and alone. So I think the misconceptions are really a lot of that is kind of furthered by public opinion, and it's just looking at the issues quite simplistically, and I think it's not necessarily the individuals. It's not that people are the problem. The policies might be the problem, but it is complicated, and I think a lot of people think it could be simpler than actually probably it is in order to meaningfully help people.
Yeah, I completely agree. And I think, both the idea that there's definitely more than that unites us than divides us is something that we keep forgetting. And actually going right up there and just being really bold about saying there's a lot of racism and prejudice in society that it's really undermining the sorts of conversations we should be having. And we should be brave and be saying that and recognizing what some of the prejudices are. But it's not just that. There is just a prejudice as well against the experience of homelessness and the assumption as to what is driving that, which I know that both Katie and Jayne will see. But something I want to come back to Katie then, politically, and we're probably on a kind of fairly charged topic, but politically, what needs to change?
Yeah, and this could be a session in itself, personally, I think, but I will try and rein it in a little bit. I think politically there definitely needs to be changes and improvements. This is just kind of speaking from our area of work, and I know there'll be other systems that Jayne sees in her work as well, but systems of inequality, oppression. So yeah, I would say there definitely needs to be changes and improvements to our current asylum and immigration systems, particularly where there are direct links to homelessness. And it's been flagged that destitution and homelessness has been designed into our immigration policies. So whether that is that people have no access to public funding or benefits or kind of mainstream housing, people having very short windows to move on from asylum accommodation, and also no right to work. So many people affected by immigration control, it's illegal for them to work. And obviously without being able to provide an income for yourself, that increases the risks massively of facing homelessness. I, just echoing some of what's already just been said, I think related to kind of like our political space, we need to stop using people seeking safety, seeking asylum, other migrants as a distraction from other areas that need political attention. And obviously we know that's kind of exacerbated through the media as well. But yeah, it's all, I think a lot of it stems back to, was it 2012, with Theresa May kind of explicitly stating the aim of the immigration policies was to create a hostile environment. And sadly, 13 years on, I don't feel like we've seen any radical change from that. Maybe people aren't saying it as explicitly anymore, but we can't ignore the racism that runs through those policies. Very mindful, this is also against a backdrop of a national housing crisis, and so there aren't easy answers. But I do think, yeah, we need to see reform to systems so that they are fair and compassionate, and with destitution designed out of them.
Destitution designed out, I think that's a really important point. And I think kind of picking up on kind of the sorts of things that both you and Fay were saying, there is something about a move or a need for a political move away from the idea that it's somehow an individual issue, but actually there's much more of a collective issue going on here. So Jayne, coming to you, but staying with this sort of issue, what do you think needs to change? Obviously, you're working in a slightly different space. It's not necessarily the kind of hostile immigration environment that's driving the issues you're seeing. We know we've got that housing crisis, but politically, where do you think we need to see some movement?
I mean, we see similar issues. We also have asylum seekers coming through. I mean, one of the big ones for me is as soon as they get the leave to remain, they're no longer supported, and they're coming through into an already stretched service, into emergency accommodation where, you know, the beds are hard. I think education, and these misconceptions as well. So not just only the wider society, but misconceptions even in terms of the homeless community, who see asylum seekers as taking their beds or taking funding away from them, and no matter how much we try and explain that that isn't the case, and these people still need that support, they don't always see it. So that can be a big challenge for us. I think definitely more money in terms of politics needs to be put into the homeless sector, and we're always wondering when a new government comes in what the cuts will be, where they'll be. So we're trying to be self-sufficient almost to a point. So we've kind of moved over to a housing benefit model, so we're not as entirely reliant on commission services through the local authority. So yeah, I do think government funding is going to be massive. I think it should be long term and it should be ring fenced. So our sorts of charities have that stability, and we know that we'll be able to carry on the amazing work that everybody's doing. But one thing for me, which might be again another lunch and learn in itself, but it's the housing benefit model for me. I think it's not set up for people who are finding themselves in emergency accommodation. It's so hard to get out of that, because of course you can't really work and claim housing benefit. So it's that how and when do you take that jump when you've got so much going on as well? You might have other issues that we've already talked about, mental health, physical health, trauma, all sorts of those things. How can people start to look for a job? But those who are in a position to be able to want to work, they just come across barrier after barrier after barrier. So only the most determined people are able to actually break that cycle, who are the lucky ones. A lot of people aren't in that position to even be able to do that, but for those who have, it's that barrier for me really that prevents them from getting back into work. And I have heard a lot of people say it's going to be easier for me to stay on universal credit because I'm not paying any rent. I want to work, but it's easier to stay there, and the money's, you know, negligible. So we don't want that. We want people to be able to work and pay for themselves, but we're in this situation, unfortunately, where it doesn't always work out. But again, yeah, investment really into prevention. I know all of us has talked about prevention and getting things in early, getting support in early, getting people to talk, sort of reducing the stigma around homelessness and poverty. For us, get people in, we can talk about that. There's other, you know, services that we can signpost to, debt advice and things like that. So it's really about, before we get to this crisis point, what do we need to be doing? Where do we need to focus some efforts? We can't just continue to manage crisis after crisis. We need to start looking at prevention really, and what we can help to do to maybe prevent some people from ending up into this situation, which unfortunately some of it is inevitable, but some of it might not be, and we'd be able to jump in there. Another one for me, just really quickly is the local connection rules. So I think, yeah, it can be really difficult when people come from other areas. We have a gentleman in at the minute. He's lived in the UK, in Bolton actually, for the last 14 years. He's been refused universal credit 3 times because they want him to prove his residency. He's got a national insurance number, he's got wage slips, he's got a son, and he's still stuck in emergency accommodation, feeling like he just doesn't know where to turn, because how can he work, how can he claim benefits, how can he pay for a house? So he's in a really difficult situation at the minute. But we have people come in from other boroughs as well who don't necessarily want to be there, so they're trying to make changes to their life and maybe move away from an area where there are negative influences or just bad memories. And it's really, really difficult to get councils to accept people coming into the local authority. So they're just kind of a few bits from me.
Yeah, it's really interesting, and I think you've given a good flavour of the kind of the breadth of the work of the BRIC there as well, in kind of like and that prevention piece and what's needed, perhaps more consistency in how we're approaching supporting people, particularly when you've got a city region that's so integrated in so many ways. It'd be nice to see more of that, I think, coming through there. Fay, then I'll come to you now, thinking, let's think more positively. Like, we've had some good bits and we've had a couple of nice examples of where things could work. What do you know, we don't do this in isolation, do we? Like, we all work in partnership, and yourselves and Boaz do work very closely. So how do you collaborate with places like Boaz to bring about positive change?
Think there's a couple of different ways. Just as an example, because we have a lot of partnerships with other organizations that provide their own, they have their own specialties. We can't all be all things to everybody who comes through our door, because there are just more people that need help. So it's a lot of it is about trying to maximize that resource and take advantage of the expertise that exists in each place. So we do refer a lot of people over to Boaz when they come through our door and have specific immigration, and obviously that's been increasing because of the increasing people with immigration issues. And probably for about 4 years now, I think it's about 4 years. Is that right, Katie? Ish 3 years. We've been collaborating between Boaz, Greater Manchester Immigration Aid Unit, and the Booth Centre to deliver a project to support people with restricted eligibility. And these people who are stuck, who are just stuck, who can't rent anywhere because they don't have employment, who can't get a job because they don't have an address, and all of that, and it's a cycle. And we each have our own specialties within that partnership. So the Booth Centre focuses more on supporting people, on European nationals with restricted eligibility, and that's kind of where we have the experience and the skills, and we can then kind of refer them through other support that they need depending on what it is that they're after. For example, Patrick, who also needed the inclusion support and the substance misuse support, and he's dead open about that, and he shouts about it everywhere he goes. So it is kind of creating those different pathways. Somebody will hear about Boaz and go there. Somebody will hear about Booth Centre and go there. Somebody might hear about the BRIC and go there. And it's knowing that we can refer people to other places and say, okay, we're not the best place for you, but we know where you can go. Really, it's having multiple points of entry, rather than multiple points of barriers and brick walls, which is what a lot of people come up against, is just constant brick walls, especially if their priority isn't this one challenge that they've gotten to one department, but that's not what they need to focus on first. It is just about having multiple points of entry and sharing that expertise, and also expanding the community of support, because individuals might not really feel comfortable in one place, but might feel more comfortable somewhere else. And that is absolutely fine and 100% essential for them to reach their goals. which first of all might be just growing their confidence, trying a hobby. I mean, these could be really small goals if you're looking at it as from an outside perspective, but for them, they can be transformative. So just to give you an idea, just in Q1 of this year, so that's April to June, we had 59 people referred into to the restricted eligibility support service from our end, and that's just from our end. So, you know, Katie would have different numbers. Greater Manchester Immigration Aid Unit would have different numbers as well. But we and Boaz provide floating support. So we have a dedicated staff member who is there to support people to navigate what is a really impossible system.
I think it's really interesting what you're saying then as well about the talking, and, you know, kind of rather than the multiple points of barriers, it's like multiple points of entry, which rightly or wrongly is probably where the flex or the superpower is of the VCFSE sector relative to kind of statutory public services. Like, it can respond, it can move quickly, it can kind of, it's not computer says no because there's a hard budget line like kind of adds the guardrails around it. It's actually how can we work better together, which is also where we know that the public sector can learn from the VCFSE and work more collaboratively to achieve the sort of change that we need, especially if properly resourced. But before we kind of get towards the end of what I found a really interesting discussion, Katie, I just want to touch on one final thing really about collaboration as a small organisation, and being a small organisation will mean different things to different scales of organisation in the VCFSE. For example, the BRIC, I know you will feel small relative to some others, but we've heard some of the difference here. So Katie, what does collaboration mean to you operationally?
Yeah, definitely some of what Fay said. I mean, the fact that it allows us to do more, and maybe that is by using people's premises, like at the Booth Centre, we don't have the facility to kind of run those drop-ins, but accessing that space, people being very generous with their resources as well. And again, crucially, it's about not working in silo, and so using others' experience and expertise, as Fay said, and ultimately to benefit the individuals. But I think also collaboration, we've had some funding which has seen us work more closely with different local authorities across Greater Manchester, and seeing and being able to flex and build those partnerships in a different way, even though we're a small organisation, being able to actually offer our expertise within that. I think collaboration has often meant as well sharing resources, and I think we try to be quite generous where we can in terms of our knowledge, or like if we've made certain kind of housing guides or resources to be able to share that. And I think we do that quite well across particularly the refugee sector locally, and we saw that, you know, it goes wider than just kind of physical resources, but also that sort of peer support and peer learning. And I know we've touched on some of the themes already around racism, but seeing the challenge of that last summer, and again rumoured again for this summer, a kind of the rise of those far right attacks, and seeing asylum hotels, partner organisations, individuals we know being targeted, being able to also offer kind of solidarity, and more than that though, like peer support and practical support aside from just the day-to-day work as well. So collaboration can look very, very different depending on the support need. Is it from service delivery, sharing resources, all the way through to kind of emotional and peer support where needed.
Yeah, that generosity of time and the support that's offered, I think, is even kind of demonstrated here today in like the three of you coming and sharing this. And I know that we're going to put this out far and wide, because I think these are the kind of conversations that show what happens when you do work together and when you do collaborate, both in terms of the impact you can have for the people who need it, but also for each other. I'm going to ask each of you a final question then. I'm coming in turn and asking you, what is the one thing, so your top number one thing that you would like to see for real change in homelessness and rough sleeping, or even kind of the wider housing instability and poverty issues that people face? Katie, I'm still looking at you, so I'm going to start with you. What's your one thing?
I asked the team for help with the support team, because I couldn't narrow it down, but they rightly brought me back to about policy change, and several of them talked about giving people the right to work, which is what I've already mentioned. And I know that doesn't eradicate the risk of homelessness, but have people having their own resources will reduce that risk of homelessness, as well as obviously improving well-being, dignity, and making the most of their skills. So that would be our policy change.
I like it. I like it. Right to work. Jayne, what's your one thing?
Really difficult to pick one thing. I mean, I could say about we need some more ring-fenced funding, which would be the obvious answer. But I think for me, really, a society change to challenge those misconceptions, really, for me, I think that's massively important, and that could break down a lot of barriers, because we have a lot of people who don't like going to hospital, for example, because they feel like they're looked down on, or they don't feel, other people are more valuable than me. It's almost like they don't value themselves as much as anybody else. So we do have amazing services, like we have a health outreach team who come in who are absolutely amazing, and that helps break down a few barriers. But really, I'd love to just educate people and try and break down these common misconceptions, and then just for everybody to be a little bit more compassionate.
Really excellent. To be more compassionate. So we've had policy change and that societal shift in thinking, which would enable so much, I suspect. Fay, what's your one thing?
I would say Booth Center operates and since day one through co-production, which means that all of our services are designed and delivered in true partnership with the people who use them. And that's how we know that they work. And that's crucially how we know what we do works. And so I would really love to challenge statutory services to adopt a similar approach. And I know it's a massive ask because it takes longer. It is more expensive. It's not by any means easier, but what you get out of it is meaningful change, long-term change. And I think also it means that you can do a lot if you change people's attitudes. And like you say, it's that societal change and policy change. So let's get some of that policy change happening, and that change in viewpoint happening at the policy level. And it'll do a lot with increasing respect for people, understanding, but asking people who are at the receiving end of these services, what is it that they need? How is that going to work for them? And so they're not done to, they're just continually done to, and they need to do with, really, with, at risk of creating a really dodgy kind of soundbite, but it is more likely to have lasting impact. And I think that's really what we're at. We're after not ticking more boxes, helping statutory services, policymakers to have lovely large numbers where they need them, and so they can show them off. It's about what that real impact is and making a real change.
Do with, not do to, I think is a great way of thinking of it. And actually, we didn't rehearse that bit, but those three things work beautifully together. We've got a kind of design and service change, policy change, and societal change, that if we had all three of them happening in the same kind of space, we really would make real lasting change on kind of the experience of homelessness and rough sleeping. It'd be incredible to see. What a way to finish an excellent conversation. I really, really value the time that you've given today, and also the time and support that you and your organisations do every day across Greater Manchester. To anyone listening or watching this, either live or at a different point, we can only get money to these organisations with your support, and that is literally what we do. So if you want to help us, please go to www.gmmergecharity.org.uk/donate, and do look at the organisations that we spoke to today, Boaz Centre, Boaz Trust and The Brick. They have lots of ways to get involved, from donations through to their events, through to the support that they need on the ground, because together we really can end homelessness. So thanks again for your time, and I hope you have a lovely rest of the day. We will bring it to a close now.